everybody, Melissa Avara here. Excited to be in the studio. I am here with a good friend of mine. Her name is Santiago, and she is a family care or direct primary care physician in Frisco, Texas. And so we're going to have a little bit of fun and do a spinoff today on, I did a podcast several weeks back called Getting Your Financial House in Order, and talked about, wills and trust and medical things and all these things people need to do to set themselves up for success financially. And healthcare is a huge part of that I think people just miss the boat on. So I want to dive into that with her and talk a lot about how just, kind of how the normal healthcare system, like what everybody thinks they have to have and how you pay out the butt for it versus someone like her, how she can stand out and provide better care, and it's cheaper, and just all the benefits that people don't know. And I mean, honestly, what you're doing, her company is called Bright Health, again, located in Frisco, and she's really, I think, ahead of the curve. So Alex, just let's dive in. I want you to tell me a little bit about, well, one, what made you want to be a doctor? I would love to hear that.
Oh, goodness.
Is this something you've known since you were little, or that you kind of grew into, or what made you want to go that route?
It's something I wanted to do since I was younger. I was an athlete for a very long time. So I was a gymnast, and I suffered through several injuries. And in that process, had a lot of experience with the medical field and really fell in love with sports medicine, like orthopedics, kind of developed a mentorship that way, did some shadowing even in high school, and really just fell in love with medical care and saw it was something I could be good at, enjoy growing up. And so that's really where it started.
Awesome. Well, so you obviously went all through school, so you could see, firsthand better than anybody, like how the system works, right? Like general doctor. I mean, what maybe a lot of people don't know about me, obviously I'm a realtor, but for a very long stretch, I was in the medical field myself. I originally thought that I wanted to be a doctor, so I kind of set myself up in school and took all the insane classes that you'd have to take for medical school, and here I am, that, biochemistry, organic chemistry, all that fun stuff, like that's doing me a lot of good right now, but whatever, learn something then. But, and then I started working with doctors, and some of my closest friends are doctors, and I saw, like just stuff I didn't want to see, and like things that I'm like, I'm getting into this to help people, right? To make a difference. And it just became so like, you couldn't do what you want to do. You can't practice medicine the way you want to practice it, because it was always about money. You have to order these procedures, you have to do this, you have to have revenue. And then it's just like meeting people like you who actually listen to patients, and you don't herd them like cattle, right? Like most doctors, it's like every 15 minutes. And I'm like, do they really listen to me, right? And I think for you, like your system is so unique. You're the only person I know who's really growing and doing things the way you are. So just tell us briefly about how, like, what sets you apart? How is your business model different than if you were just to have Blue Cross Blue Shield and I have to use this doctor because they're a network kind of thing?
All right, you can have insurance coming to my clinic, but what I practice is a model called direct primary care, and this is an alternative form of healthcare. So you actually get a monthly membership, you pay just a straight monthly fee, and it gets you access to almost all primary care. I'm a family medicine physician. You don't have to worry about any copays, deductibles, like surprise bills. Everything's so straightforward and transparent. You can come in and see me as many times as you want. I spend up to an hour plus with my patients because I get the opportunity to do that. I can really take the time to listen to patients, find out what's going on, and address all of their concerns. There's no just dishing out medications and just treating superficial issues. So all in-office procedures are covered. I don't like to nickel and dime people. Like, that's not what I'm here for. and I get really good discounts, wholesale pricing on labs, imaging, and so a lot of people end up saving cost money when they come and use my healthcare model.
So what's the difference? So like say just like a single person, right? Maybe they're self-employed, maybe they're not, and they want a membership with you versus like a family of 4. Like what's the cost difference between like one person and like a family?
Okay, so a single person, just individual, is $115 a month. For families with 4 or more families, I do give a 10% discount. Kids are less, they're $55 per kid. And then I also do work with small businesses and I give a discount. So for companies that want to provide an alternative form of healthcare for their employees, I do provide a discount for that.
So the awesome thing is all I'm thinking about, right, is like most people, they have insurance and it's like, hey, you have a $5,000 deductible. Annually, nothing's covered until that's met, right? So it's like, if I didn't have insurance and I come to you and I'm paying, say $350 a month or whatever for my family, right? That doesn't matter. I could come see you every day, right? Every single day, which
I mean, you could.
Not gonna happen, right? And it's like it's $350, so I'm never having to pay a copay. Like there's no
additional cost.
No additional cost. And I think that's what people are, just skeptics. Like if something sounds too good to be true, they're like, what's the catch?
Absolutely.
Nothing is this cheap. Like, for example, I got my daughter like 2 years ago. We had to rush her to the ER because she was having a seizure. And I got a massive bill from them, right? And I was like, okay, I'm not going to pay this all at one time. So I just gave them my credit card. I was like, charge me X amount a month. And they were just billing me regularly. And then it stopped. So I just assumed it was paid, right? Years had gone by. Haven't heard. And then like 6 weeks ago, I get this letter in the mail saying they're going to report me to some collection agency because I have a $5,800 outstanding balance. And I was like, what the hell? And so I call the company. They can't tell me anything. I called Children's and they're like, we don't have any record. And I'm like, well, is this bill fraudulent? Like, what is the deal? And I went back and saw how much I had paid in, which was a lot. And then they come back, they're like, no, you still owe X amount. And nobody could like give me any kind of real clarity. But I was like, this is ridiculous, right? Like the last thing I want is for a bill that I could have paid to now go on some kind of financial record. So it's funny, what a lot of people don't know is I called and I just said, hey, look, I have this bill. I want to pay it in full. I want to make this right now. What can you do for me? And they're like, well, we'll give you a 25% discount if you pay it in full today. And I'm like, here's my money. Take it. Right? And same thing, like when I had a bad accident, like almost 16, 17 years ago, same thing. I mean, I got a care flight bill for 10 grand and it said, you could have chosen a better provider. Well, you know what? That's the last thing I'm thinking of is I'm laying there waiting for paramedics to come rescue me, right? Are you in my network? And then I called them and they cut the bill in half, right? So it's like you don't know what you don't know, right? And like at the end of the day, I would think, wouldn't everybody want a doctor in their corner who actually cares, who listens to their patients, who spend time hearing them and developing whatever plan they need. And then you're also available. Like they have a number that they can reach you, right?
Yes.
Most doctors don't do that. It's like call the after service, call this. Like no doctor wants patients bombarding them, right? But it's like maybe your patients don't abuse that like a lot of people, but
they don't. I think it's because they have that security. They know when they need to reach me or get a hold of me that they can.
Yeah. So how would it work if like somebody's coming to you and then say they need a procedure like a colonoscopy or some kind of something, right? Well, obviously that's not covered because they're going to have to go to a facility to have that done. But can you get any of that discounted or like what kind of procedures if you're like, can people actually get a discount on through you if you're like ordering certain things? How does that work?
Well, surgical procedures and things that a specialist would be doing, I can't personally provide discounts, but I am familiar with a lot of physicians in the area. And I I work closely with them to find out what their cash pay costs are. And a lot of times we'll talk to patients like, here, there's a specialist. This is what they tell me their cash pay is.
Yeah.
And find them a good specialist with an affordable rate, because people can charge whatever they want. Like,
Oh, yeah.
hospitals can just, this is how much we're going to charge. Like
Just
you
for a
said.
facility fee.
Yeah.
Yeah.
There's no regulation on healthcare costs. So I am able to help patients find a good provider that is affordable. As far as like procedures that I do in my office, those are typically going to be covered under the membership. Like, I do some basic family medicine procedures like, sutures, I do abscess drainages, I do a lot of, like skin lesion biopsies and removal, things like that. And I don't charge extra for that because the supply costs are so minimal. But if you go other places, like the skin procedures, if you take off a skin tag, for example, insurance doesn't cover that because it's cosmetic. And so you'll pay hundreds just for that silly thing that takes 2 seconds.
Yep. Yeah, that's crazy. Now, like the labs, like obviously there's a lot of people like routinely need lab work, or what routine or not routine. So it's like, what kind of cost savings are we talking about? Like, what's average compared to like what you can get it for?
Oh, that's funny, because there's like no average. Like, nothing really regulates healthcare costs. So there's not really an average, which is funny. But as far as like my clinic, if people pay cash in my clinic, I get annual panel labs with everything that's, you would typically order for an annual exam for less than $20. Most people are blown away. They're like, I paid $400 for this exact same thing last year.
Oh, 100%. I mean, I think just over years of my life and being ran through the medical ringer, I mean, like, I was poked and prodded my whole life. I had to have blood work done like weekly, for things, just to see like what drugs were working, what's not, all the stuff. And it's just like, I know the cost for that stuff. I mean, it was just through the roof.
It shouldn't cost that much either.
No.
It shouldn't. Like, there's no reason for it to cost that much, except for they can charge that much.
Yeah.
And of course, insurance companies are out to make money. They don't want to save people money.
And, I mean, I just laugh. It's just like, and you tell me, but I feel like having worked in that industry, it's like, it's always the first bill that you get, but sometimes doctors are the last to get paid, right? Somebody gets like a huge bill. Well, I can't afford $5,000, and people just don't pay it. Or they'll take 10 years. They'll pay $5 a month, and just so they don't get reported to collections.
Well, and correct me if I'm wrong, but even if you have insurance, this is something you should look into. And I'll just use my focus group of one. Like, I went to get an ear cleaned out.
Oh my goodness.
And, even with my insurance, it was still like $150.
Oh wow.
To get that done.
That should cost nothing. They use some water. Like, there's no materials even used. They just squirt some water in your ear. Yeah, I charge I don't charge additional for that. What am I going to charge you for?
The best though was, and then now this was a specialist, and I love this. This guy, he's a liver doctor, and he's great. He's got a great sense of humor. And I went to his office for a follow-up, and he came in. I paid my copay, which was like $186.
Of course, because it's a specialist.
Before I even got to, so then I go into the examining room, wait 15 minutes, and the guy comes in. He's wearing his COVID mask, and he looks at me and says, "When did you start drinking again?" And I said, I don't drink. And he said, "Not according to your liver numbers. You did the labs and they came back." He said, "Here's what I want you to do. I want you to schedule a biopsy because I can't figure out why your numbers are so high." And I looked at him and I said, "Really, that's what you're telling me to do?" He said, "It's a real easy procedure. It's no big deal."
Doesn't sound like it.
And it doesn't sound like it, but it's really no big deal. And he explained it to me. And I said, "Well, I'm not going to do it." And he said, "Well, why wouldn't you do it? It's simple." And I said, "Doc, you just charged me $166 out of my pocket to come in here and do nothing to me other than just tell me to go somewhere else." And he, rather than justifying it, he just looked at me and I could see him smiling under his mask. And he said, "I charged you $166 or $186. You should see what I charge your insurance company."
Exactly.
And
then you get the bill from what's left over.
So I mean, even if you have insurance, these basic visits can still cost you.
Oh yeah, absolutely. Most people have high deductible plans too, which don't even cover that much. You have to meet your deductible, which is $5,000, $10,000 sometimes.
Yeah.
And so, I mean, you're paying. If you look at your costs throughout the year, the costs are crazy. Our family, like my family, we have a family of 4. I mean, we are all self-employed. Like my husband and I are self-employed. So we have a health share plan because the price of insurance is just way too much and doesn't provide anything, no benefit really for us. So,
I mean, and you are not the first physician. Like, I know so many physicians who they don't have insurance.
Oh, yes.
Because they're like, they see this, they know. They're like, yeah, you're pretty much getting stolen from.
Did you experience that when you were in the hospital?
Oh my God.
Did you talk to the nurses and the medical professionals? I was shocked.
How many didn't have
How
insurance?
many did not have insurance?
Mm-hmm. Yeah.
It's important to have some type of coverage because, I mean, you can land in the emergency room at any point in time.
Yeah.
And
right.
those fees are astronomical. Like, I can't afford that, like a one-time bill like you experienced. So it's good to have some type of coverage.
Yeah. I mean, and that's why I'm always kind of like, I call it a no shit plan.
Yeah, that's exactly what we have.
Because I have had that happen to me where I never thought I'd be in this position, and now I'm hundreds upon hundreds of thousands of dollars of medical bills. And I'm like, oh my God, this could bankrupt someone. Mm-hmm. Right? I mean,
there's a really great book that I read. I can't remember who writes it, but it's called Never Pay Your First Bill. And it really educates you on the healthcare system and how just messed up it is. And that's, healthcare costs, you don't have to pay your first bill because there's nothing like regulating these costs. And so like what you did, call them up. There's some things that you can do to fight these costs. You can try to look up average costs in your area for the procedures that you had and use that as ammo basically to say like, hey, this cost is not fair. And so I'm actually trying to do that right now because we took Luke, our youngest, to the emergency room not too long ago. And our bill was crazy. It was like $2,700. And the majority of that was for the labs that they did. Jeez. All they did was a metabolic panel and a blood count. The blood count was like $400. The metabolic panel, maybe $900. That cost me $4 for both of those labs in my clinic.
God, that's so ridiculous.
Isn't that? I almost told them, like, please I don't need the labs, just do the imaging, but I don't want to be that doctor that was like, no.
I mean, you would think there's some level of like professional courtesy too, right? Like from doctor to doctor. Like,
no.
hey, we'll take care of each other.
Sometimes it's almost the worst because they assume as a doctor that you can afford a $3,000 bill, but that's not always the case.
Right. Yeah. No, I mean, it's crazy. I mean, I see my dad several years back, he had a stroke and he started getting inundated with bills. And I was like, Dad, just let me, I would love to see some of these bills because I had gone through, I knew the process. And I mean, like, I'll never forget, I was buying my first house and my lender that was helping me knew, like, I'm very anal about good credit score, always paying my stuff off. Like, I don't want to owe anybody anything, right? And he's like, hey, Melissa, I just wanted to let you know. He's like, this is on your record. This $40 medical bill from when you had your accident. He's like, it's not hurting you. And obviously, it's $40. You could have paid it. But I figured it'd piss you off because it's on there. And I'm like, it absolutely did. I looked into it. I had to jump through hoop after hoop after hoop. Found out it was a fraudulent bill. That doctor doesn't even exist.
Oh, wow.
Like, doesn't even exist. And then all this other stuff started, like, once I researched it, other people had the same issue. And I'm like, man.
There's all kinds of fraudulent billing out there.
Yeah. I mean, it's like you don't know. Like, when I was in, like, the worst, and the guy, he felt really bad about it. So I was in this horrible jet ski accident years ago. And I got a bill from an orthopedic surgeon for a massive surgery. And I'm like, okay. I knew exactly what those, like, IDX or CPT, like, all the medical codes were, because I was in the industry. And I'm like, oh my God, I am getting billed for a surgery that I didn't have. What the hell? So I call the office, and I tell them, and they're just giving me the runaround. And finally, like, I had, like, a friend of a friend, like, so I kind of had a personal connection with this doctor. And I was kind of surprised. He actually called me and just profusely apologized. He's like, Melissa, I am so sorry. Please disregard. They sent me the bill. Like, the guy that I was in the accident with had the surgery.
Oh,
they were sending me his bill. They were billing me for what they did to him.
I hope that was an honest mistake.
Well, one would hope.
Yeah.
But I'm like, I'm calling them out on it. This is ridiculous. But like most people, like they don't know what those codes mean. It would be over their head, and they're just like, well, shit, I just got a big bill. Now I got to pay for it, right? So I'm like,
You're right.
so I mean, I always say call, ask if you have questions. I mean,
You can get your full bill and breakdown of the codes, what they mean, and so you can find out what the cost should be.
yeah. I mean, but just from like bottom line, like financial savings, I feel like, I mean, even us personally, like over years, like being self-employed, getting insurance is ridiculous. I mean, all three of us are self-employed, so we know. And I remember, so for example, I still have some issues from that accident where I need certain things like medical supplies or whatever. Insurance will not cover it. No insurance company covers it. So every month I just have to pay out of pocket
Oh my.
for the stuff that I need to be alive. If I didn't have it, I would die. Right? And this is the argument. Like I went to see my doctor at UT Southwestern a few weeks ago, and I was telling him, and he was just appalled.
Yeah.
And I'm like, can you write me a letter or like something? He's like, I have never heard of an insurance company not, this should absolutely, you have to have this to live. You know, it's like diabetic testing supplies. Like if I was diabetic, that would be covered, right?
Should be.
But I'm not. So, and then the other thing that will probably blow your mind that you probably, I don't think I've ever told you, is nothing, absolutely nothing with my pregnancy was covered under insurance.
How's that impossible?
Exactly. So I get pregnant, and we
Oh
had
my, I can imagine the cost.
we had
of that.
recently just switched insurances because I don't remember why, but switched. And then I found out I was pregnant. And they said, hey, none of your pregnancy will be covered because it's a pre-existing condition. Well, I ended up having to go through just hell. I mean, I had to have this procedure called an aversion because she was breech. And I had to turn her and do all this stuff. And then I ended up being almost 11 months pregnant. I went so long, and then all these medical complications. And then when Nora was born, I didn't think I was going to have a kid to bring home. She was in the NICU for 2 weeks, not breathing, on an oscillating ventilator, on all the stuff. None of it. None of it.
Wow.
And I'm like, do you know how much it is for a kid to be in the NICU for a
It's a lot.
day?
It's a lot.
And at that point, I looked at Clint and I was like, oh, what are we going to do? Like, I mean, this is not a great way to start. I mean, we figured it out. You know, I'm like, this isn't my first rodeo. Medically, I've done it once. I can do it again. I'll figure it out. But it's just, it's absurd. Like, nobody would think a pregnancy is a pre-existing condition.
No.
I've never in my life, and nobody I've ever told that to has been like, oh yeah, that happened to me.
No.
Like I was cash pay everywhere.
Wow.
You know, so that's why I always laugh. I tell people, I feel like, God, having kids is so expensive. And all these people are like, I don't feel like my family's complete unless I have 4 or whatever. I'm like, what's wrong with you? You know? Because I look at it, this was my thought 10 years ago, so I'm sure it's probably doubled since then. But from like birth to when you get the kid out of your house, just to raise a child, I would think is easily 7 figures. Like all the stuff, just everything they need. Probably more.
Yeah, probably more.
Right? And then you don't expect, you know, hundreds of thousands of dollars medical bills straight out the chute because the NICU is not covered or the this and the that. And I'm like, so, I mean, like, what you're doing, I mean, I just don't feel like one, they don't know what they don't know. So that's why I wanted to bring you on today. I mean, like, if you're one of those people out there and you're paying $1,500 a month for insurance to cover your family, and then you have a $10,000 deductible, and I feel like most people, they pay for something they never even use because it's like, oh God, I feel bad, but I don't want to go to the doctor because it's going to be $1,000 bill that I don't want or can't afford. And I'm like, you're just paying for all these what ifs. And I mean, to a degree, right, you need to have some protection for yourself. But I mean, if you want someone in your corner who knows their stuff, who's going to give you the care and everything you need and is going to cost a fraction right here. I mean, what's your website?
brighthealthmed.com.
And based out of, again, Frisco, you're at Legacy and
121.
okay, so pretty much like, yeah, right, Stonebriar
Mm-hmm.
area. And I mean, to me, if anybody, but if you're a self-employed person, if you own a small business and you want to be able to provide some kind of coverage for, your employees, like, talk real quick about that. So it's like, if somebody has a business and they say they have like 10 employees or less, like, what does a structure for them look like?
So I work with employers and we can come up with whatever works for them, but the majority that I have right now, the most common is that the employer pays for the monthly membership for their employees. For 5 employees on, I do offer a discount. And then the employees or members then pay for any additional costs. So that's usually just going to be any outside services. So labs, for example, imaging, that type of thing. But the employer just pays for that monthly membership.
Yeah, that's awesome. And I mean, and like, as far as like the panels and stuff like that go, I mean, can you pretty much order, like, if somebody's wanting to do like a blood panel to see like different things, like, I know like from like a nutrition standpoint, right? Like, maybe you shouldn't eat this, or like, hey, like I had a friend of mine who went through this whole panel, like all kinds of stuff with doctors, and found out like all this stuff that he eats, you think is good for you, like spinach, and he's like, it's terrible for him. Like how it processes in his body and all these things. And I'm like, who would think, like, you're eating a green leafy vegetable, but for him it's not the right thing for his body. They're like, eat kale instead, or like whatever it is. But he found this out by going and having all these, panels and stuff done. So, I mean, can you do all kinds of different lab panels, or is it just more like the basic, like, annual kind of stuff that you would?
So I'm full spectrum family medicine. I can order everything and anything, but I'm only going to order things that actually make sense, actually provide like a purpose, are going to change management. So I'm not going to order things willy-nilly or just to make money. There's a lot of places out there that literally, like, even just your big hospital systems, they work under a system that they only get paid for what they order. So it's called an RVU system. So they get points for ordering labs, imaging, seeing patients. So the more that they do, the more that they charge patients, the more that they make. So they have an incentive to charge people more money, which is crazy. But anyway, so
that's the world we live in.
I do what's indicated, and I always have a discussion with patients. I have that time to really educate patients, have that discussion, and determine what's the best course of action. But I can order anything. Just a lot of things out there are bogus. I'm not gonna lie.
Yeah,
a lot of them are just for money making reasons, and I'm not going to go down that route.
I mean, that's why I got out of the healthcare industry. Honestly, I mean, I was in medical sales, so very different, right, than what you're doing. But I was in clinics. I was treating patients day in and day out. And it just got to the point where, like at the end of my medical career, I was in pediatrics. And I was working with such highly involved kids that just had, it was just so sad, like things wrong with them. I'd get like an 8-year-old who's never walked before. And they're coming to me wanting me to build a device, like, hey, you're our last hope. Is this device going to work? And I'm like looking at the kid and I'm like, I know this. I'm refused to run this family through the ringer and give them false hope. I knew it wouldn't work. For a lot of kids, it did work. And it was joyous to get to experience kids take the first step or whatever their issue was. But when push came to shove, it was like, hey, Melissa, you need to sell more of X. You just saw 80 people in this clinic. Why did only 30 of them get this? Because the other people weren't going to work for it. That's why there's an ethics, a code of ethics, people, right? Exactly.
There should be.
But it was all about, well, your numbers are going to be down. It was all about a bottom line. And it made me sick to my stomach. Like nobody, do you people really care? All you care about is money. And I feel like the bigger the organization, again, it's all they care about. I used to work in oncology. I saw the same thing. And I was like, I am out on all this. Like, if there's any field that I think people need to be compassionate about because people are really getting run through the ringer, it's that. But when I saw a doctor and a practice manager getting excited over how much money they were going to make off a brain tumor patient,
Oh my goodness.
I quit that day. I was like, there's just a level. I mean, again, there's a bunch of wonderful doctors out there, not knocking it, but it's just my own personal experience. And now here I am. I help people buy and sell houses, and it's more rewarding to me than anything that I ever did, on a different scale. So thanks for being here. This was good. And guys, again, if you're in the market and you need a good doctor and you want a better alternative, look Dr. Santiago up. You will not be disappointed.